There we go. Okay. When you do classic gym exercises, you tend to do things like stretching. No, you can't see anything there. You tend to do stretch, and then try the other leg and stretch. I'm sure this is working very well. Anyway, in yoga exercises, as opposed to gym exercises, the general methodology that you use, and it does make a difference to how the body works and the length of the body and the length of the ligaments, I'm sure of it, more so than gym exercises, is you go into a stretch. So the general idea is, there you are. So the general idea is you sort of go into a stretch and you breathe 7 breaths within that stretch. Does that make any sense? So you sort of hold the position and you don't just count. It's a bit esoteric, I'm afraid. You don't just count to 7, you sort of breathe 7 times while you're in this position, and then you sort of come out of the position, give yourself a rest for a few moments, and then when you return to the position, you do the same thing again, and this time you'll generally notice, pretty immediately, might be a few goes before you get it, that you can stretch much further than you had been able to before. But you don't pull too much, you don't stretch, don't over stretch and over push it till it hurts or anything silly. You just gently push it to where it's saying enough, then you breathe another 7, and then you come up, and then you do it again and again. And over the days, weeks, months and years, your leg gets floppy. What I was trying to do is trying to get a yoga exercise for scoliosis that was able to incorporate that essential yogic technique for where the curve is, where you get the curve to sort of, you stretch the curve to reduce the curve, and then you hold for kind of 7 breaths, come away, have a rest, come back and try again, and this time you know, try a little bit more to stretch it. And that way, the same way that you permanently change the sort of the way your legs and your back generally go when you have a yoga exercise, it hopefully will, you know, permanently change the spine and its position. I think, once again, this needs to be done in conjunction with, it might work on its own. I think it's best worked in conjunction with Theraflex, because Theraflex kind of unlocks things in the back, and then it seems to only unlock it to the extent that the back is ready to unlock it. So by doing these sort of yogic exercises, or that yogic technique on your back, more than, I don't think it's not a standard yoga exercise, the one I'm going to show you now. And what it does is it uses a sort of a weights machine in the gym, and what you do with it is you sort of hold on, it's like a monkey bar type thing, except there's a sort of a weight underneath your legs, so it's not your entire weight of your body that you're kind of holding on to. The thinking being, if you're holding on to the entire weight of your body from a monkey bar, then you can't really do it for more than a very short amount of time, because my arms are sore, my hands are sore. But by taking on the machine, by having sort of a bounce weight up in front of you that's not your full weight, or say it's half your weight, you can hold up there for quite some time. And while you're there, you can do lots of deep breathing exercises. So while the back's getting quite a good stretch, you do that sort of yogic sort of breathing, like general sort of thing. You take deep breaths. That's really not yoga to do deep lung breaths, but you get the general idea. It's the upper torso we're trying to work on here. And yoga is all about sort of belly breathing and, you know, don't move your upper ribs, which, you know, is not working for what we're doing here. And I find that when I do this, I can feel things moving in the upper spine and in the back, and actually all the way down to the lower spine as well. And I think that's a good thing. It's a bit Scroff-like. I haven't done Scroff, I'm not trained Scroff bod, but having read some of the books, they do lots of stuff where they are doing lots of breathing, deep lung breathing, while in sort of various positions. A lot of that stuff in Scroth, from what I can gather, takes a lot of time to do. So I was looking for something that you could do for a few minutes a day that would be very effective. And this seems to be, feels like a very good thing. Now, it's also a bit difficult for me at the moment to see what my spine is like, because at the moment it's quite flexible. I can stand in one position and sort of, if I sort of breathe in or out, you can see the spine at the back actually move. And so when they say stand up straight and be as straight as you possibly can, one breath here or there it moves my spine by quite a significant amount. This is in the upper spine, where the last of the curve is. So it's normally quite sort of rigid, but nowadays with all these exercises and Theraflex, it's quite flexible, and the angle of the back seems to change from breath to breath. Okay, and by that I mean this. This is a picture of me in the gym. I'm just kind of doing some time and motion type things. This is me moving. There's some stills from a video. And you can see the curve in the spine kind of appear and disappear, depending just where one arm is or one part of the breath. You see it moving dramatically quite a lot, at quite a lot of degrees. Just to prove that the yogic technique works, I'm a cranky 45 years old, and I do ballet as well as a little bit of a hobby. That's the sort of level of flexibility and strength using that basic yogic technique, and this is what it can do for the legs. Then why not the back if I use the same technique, despite not being a yogic exercise in the book. Okay, so this is the hanging machine, as I call it in the gym, where you sort of put your legs on here, and there's some weights here that sort of take half your weight off. You kind of select them, and then what most people do is they kind of use them to go up and down as a sort of a pull-up assistance. But what I'm suggesting to use it here for is to use it as a sort of a yoga for the back type thing. So if you were hanging straight down from a normal thick stuff without any weight pushing up, you wouldn't be able to hang that there very long. So yeah, sort of hanging there from the top with your hands like a monkey. And but what you do is, because you can take some of the weight off, you get quite a good pull. You get quite a good stretch, and then you see, like, what you do is you breathe, do lots of breathing, and really try and work and open those rib cages. And it's sort of trying to get that yogic kind of thing in the exercises, whereby you work it, you breathe into it, you stretch it, you lengthen it, you sort of kind of do that sort of stuff. Now as you're breathing there, it's your lungs essentially that'll be sort of, you'll go up and down a little bit, but not by using your arms, but just by using the power of your sort of your lungs, your sort of rib cages. Okay, this is a kind of a hanging frame in the gym, and you sort of they call it a TRX machine. There's no moving parts. What I'm showing here is if you sort of I was just showing the sort of moving forward and backward, and in those two positions do lots of breathing, and it sort of really puts a kind of strain on the back when you're leaning forward, and the front muscles when you're leaning forward like that, and then you hold that position and do lots of breathing in it, you know, so if you really sort of work the rib cage in and out. Okay, now this is me trying
trying to explain to everybody how to use 2 or 4 mirrors, depending on what type of mirrors you got, so that when you look into it, you can, when you look into the mirror in front of you, because you got the mirrors at different angles around the place, like a changing room and a you know, a clothes shop, so you look in front of you, and because you can see the reflection of your reflection of your reflection, you can see your back. Because the difficulty when you have scoliosis is when somebody says stand up straight, you don't really kind of get that right a lot of the time. So you kind of use a few mirrors to kind of check your position and get into the straightest position you possibly can be, and then see how that feels, and it'll feel slightly different from, that's the mirrors I've got knocking around the place. In this case I'm trying to use 4, I don't tend to use 4, but the general idea is if you only use 2, you kind of have to twist your head rather a lot, but if you can use 4, then you can, the angles are less sharper, and you can look straighter into the mirror and still see your back. And once you can see your back, because when you turn your head, your kind of the upper back moves and curves, so you don't know if you're compensating for that, or so the straighter you can, the less you have to turn your head when you're doing this, the better. And I think I'm still gibbering on this video. And yeah, so the general idea is you use these mirrors to see what your back looks like, and then try and move your back into the straightest position it can be, and at that stage in the game you'll start to feel different muscles work that would otherwise not work because your back's not normally in that position, and then you kind of stay in that position and move a little bit in that position with your arms and legs and with your head, and then see how that's affecting how the muscles are feeling. And it's getting the body used to standing up in a straighter position and getting used to that sort of position.